No.
Okay. Right, we're in shot.
Hi guys.
Back again. Okay.
Right, this is the Q&A session, which some of your subscribers have asked you.
AIDS. I don't think I mentioned it. I don't know if I remembered.
Yeah, I think you did.
Yeah.
It's
No one asked anything.
they're just questions that seem to come up a lot.
Yeah.
So.
The first one that somebody's asked is there a cure for this tinnitus? And if not, why not?
Okay.
That's the big question that always comes up when people are first struck with it.
Yeah.
I want a cure. I want a cure.
Yeah.
In the mainstream medical world, as far as I'm aware,
there is no pill or surgery that will go and switch the tinnitus off. There isn't. You know, there are things that can affect it. There are things that they do use. Like, I'm certain we'll end up getting into that a bit, but there's nothing that works across the board in all cases. You know, there's no mainstream cure. The reason for that is, like I've discussed many times, my personal belief on it is that the way the medical community looks at the human body, the way they study health, they look at symptoms and they try to address that. They don't really work backwards. And the problem with tinnitus is that it's an accumulation of so many different things, and generally just the neuron activity is too high because of all the stuff affecting the nervous system, all that kind of thing, and that's a very deep-rooted issue. There's no pill that will really... There's no pill you can use to bring that down that will only affect that.
Yeah, I think with tinnitus there's so many factors. It's such a complicated, bizarre condition.
Yeah.
It's going to be difficult to find a pill or a medication that's going to address acutely that, because it's such a bizarre condition of the mind. There's so many factors to it.
Yeah.
In terms of surgery, I know they are trying different methods from some of the research that I've done and the videos I've seen with the Parkinson's patients.
Yeah.
Some of the Parkinson's patients that have had this open brain surgery who had tinnitus, after they've had this surgery for the Parkinson's, not only has it helped the Parkinson's, but for some of them the tinnitus was removed. The trouble is the surgeons don't know why or how or what parts of the brain have affected this, but in some cases it's gone the other way.
Yeah, and it gets worse.
It gets worse. Some Parkinson's patients have had this surgery for Parkinson's on their brain. It's improved their Parkinson's, but then they've developed tinnitus afterwards, so it's gone the other way.
Which this goes into what we talk about with it. It's a very complicated, very deep subject. I don't think there's a doctor alive that, with the way they look at stuff, and again this is purely my own personal opinions, but none of them have a big enough grasp of the whole picture of health, you know. To get someone that knows enough on that kind of stuff, they tend to specialise in a field. They look at one part. And this is why you get to the point where you get surgeries like that. They're very powerful, you know, very strong types of treatment, you know, whatever way you want to call it.
Invasive, isn't it?
And in some people, it will, as a byproduct, hit the right bit. And in others it will make it worse, and that's why I really don't think looking to the medical community for much help in that way with this sort of thing, I don't think you're going to get much out of it in most cases.
I think in the future, I think at some point in time they will be able to come up with a surgery or a therapy or some form of medication, something. I think in the future the medical world will come up with what I'm going to call a cure, but it's not going to be any time soon.
Well, that's where we disagree, I think, on one of the few things we actually disagree on. For the most part, I don't think they're going to find it. I think any type of treatment they get will be more along the lines of what they've already got, you know, gabapentin, things like that. It will be along those lines, and it will have side effects, because this is such a big fundamental thing in the body. It's caused by such a fundamental dysfunction. You're never going to be able to hit just that with no side effects, and the side effects are brutal, because to get it to come down you have to hit such a big part of our function. And yeah, I don't expect a cure from the medical community with it. I don't think it's an issue of money or funding or time. I think it's just the way they look at it.
Yeah, my view on it is rather than a pill or a drug, because as you say, any drug that's going to affect your mind is going to have side effects, as I've recently found out.
Yeah.
Because with tinnitus, it is such a complicated thing. The drug isn't just going to be, I don't think a drug will be able to just pinpoint that.
No.
It's going to affect
They're
all
not
of
that
your
specific.
mind. No.
Yeah.
I think, my view is that at some point a form of surgery, once they find out what parts of the brain are affected by tinnitus, recent seminar by a professor, I think I'm sure you've seen it, where
the TED Talks one.
That's it.
Yeah.
Yeah, that's the one.
Yeah.
Where the guy at the end of it says, "We're not there yet, but help is on the way." They've got a type of MRI scan. It's not a normal MRI, but the new type of scan, where they can see parts of the brain are a lot more active with tinnitus. People that suffer with tinnitus than people that don't. So they're starting.
They're
to
looking
look
at the right bits,
starting
but
to look at
that's
it.
where I disagree with the approach, because they're looking at the end result of whatever stimulus causing the brain to grow. It doesn't happen by magic, you know. Something has to cause it, and I think the better approach, personally, is to find out what that core bit is, and the stuff we talk about with emotional stress and all that. There it is.
So
you know?
treat the cause before you get to the...
before you get chopping up the brain, hoping it will work.
Treat the cause first before you get to the point where you're having to have something like that done. But yeah, at the moment, no, there is no cure. They can't offer you anything to cure it.
No, there are things that they can offer that could help, that might help, but you really, like you said in your videos, you're weighing up the pros and cons of it. If you're desperate, they can be useful. You know, I'm not going to knock them, I don't talk about them too much myself, but if you're that desperate, they can be quite useful. You know, but yeah, as far as the question goes, there's no cure.
Yeah, with in terms of medication, I mean, when I started taking the gabapentin, that was when I had that spike and I was prescribed that, and that's the trouble with the drugs, the medication in forms of drugs. If it works, you want to keep taking it, but in the background it's affecting the rest of your mind without you realising it, and then you want to come off it,
and then you get withdrawal,
and then you're in a bad place. And you know, I've been in a bad place for a little while, so luckily I'm okay now. That's why, you know, I'm able to make this video great today. But my advice, and I've recently said to one of my subscribers, he was thinking that he's had a bad spike, try and ride it out naturally.
I think we get at that question in
without.
a bit.
Okay.
Another question that's often asked is tinnitus caused by damage to the ear hair cells? And if you think it is, how can we get better?
It's a factor. It's a factor. You know, I don't think it's a causative thing, but then it depends how you look at it, because depending on your perspective, none of it is the lone cause. There are definite physical things. I believe that hair cell damage will lower the threshold for you to, you know, it will reduce the stimulus you'll need to develop tinnitus. It's more dysfunctional in general, but there are other areas I haven't looked at properly yet, like the role of the limbic system. It's meant to compensate for that sort of thing. You know, stuff like that. Again, I haven't looked into it, but it's not a direct, clear-cut case of hair cell damage, boom, tinnitus, you know. Otherwise, all deaf people would have it. Even people with the most minute, you know, I've had people make that argument with me in certain bits. Just, if you have tinnitus, you have hair cell damage. Doesn't matter if they find it or not on a test. Even their most accurate, full frequency range tests, if you have tinnitus, you've got, you know, it's not true. It's not true. It's the medical community assuming based on the assumptions they've got. And I've asked a lot of people, please point me to the research that says specifically, here's the connection we're basing this assumption on. I haven't found it yet, and I'm starting to think that it's just this complete bare bones assumption that they're making, because it seems so obvious, because we hear it in the ear, there must be something wrong with the ear. If there was, the treatments they've got would work much more consistently than they do. And they don't.
With the hair cell damage issue, I mean, even if your tinnitus has, let's say it has been caused by hair cell damage, once that's happened, your hair cells don't grow back. And if it was purely your ear that's causing you to hear the tinnitus, it wouldn't fluctuate. Once your hair cells are dead, they're dead. So the brain isn't receiving the correct pitch or tone from the hair cells in the form of vibration, which is what sound is. So my opinion, my theory on this, is what I believe, is that when your hair cells are not sending the correct pitch and tone, or whatever you're hearing on the outside world, your brain, there's a gap. Your
It
brain,
fills the
yeah,
gap,
your
yeah.
brain doesn't like gaps. The auditory system does not like gaps, and your brain will try and fill that gap that it's not receiving from the hair cells that are damaged. Now, there's no point treating the ear or trying to treat the ear because it's no longer the factor. That now you need to treat the brain because it's the brain that's creating the noise. That's why people with hair cell damage, like my friend who wears an auditory device, when he gets in different emotional states, his tinnitus fluctuates. It goes up and down like
It's
us.
clearly not purely a physical
Yeah.
issue, even if it is a factor.
That's not his ear.
Yeah.
That's his mind and the way his mind, the neurons in his mind that are affecting his tinnitus.
Yeah.
So this notion that it's all about the ear is not. I don't think it's
Well, like
correct.
we've said many times, if that was the case, every single deaf person on the planet would have it. Every person with even the most minute amounts of undetectable hearing loss would have it. That would be all of us, I think. Not all of us have tinnitus. All of us here probably do, you know, all of you watching. But
And I mean, our hearing's fine, and we
Yeah.
have tinnitus.
yeah, mine come back perfectly clear on a standard test. I've never noticed any issues with it. You know, I've seen people say they got the full 20 kilohertz test to be on the safe side. Again, nothing. It's just, it's either ego or money or ignorance driving this assumption from doctors that stay to this claim that it must be the hair cell damage, even when they can't find anything wrong with it. You know,
They seem to
something's
hang on
going
to
on there.
this.
Yeah,
They seem to hang
and
on to this
that
thing
comes
about
back to
the
my
ear.
point. That's what they look at. They, you know, that's their worldview. You know.
So
Whereas we don't have that, we're not doctors, we're not professionals like that, we're suffering, dealing with this ailment.
So yeah, bottom
We
line
just
with
all about
this,
experience.
with the ear notion is, yes, we know you can get tinnitus by trauma to the ear, hair
But it's
cell
not a
damage.
definitive causative
No.
factor, and focusing on that won't help you improve it, is the fundamental point.
How do you get better with it? By treating the mind and your emotional state and all the things that we've spoken about,
Yeah.
not treating your ear.
Yeah,
Pretty much, that's where we are with that.
yeah. Focus on the nervous system.
Yeah, and
It will get better.
Aid, you mentioned about your friend having an auditory device.
Auditory, yeah.
Yeah. How do you think this would help if somebody chose to use one of the devices?
I've never used them. The only thing I've come close to that is when I was first struck with it was using white noise in the evening to shroud it to go to sleep.
Yeah.
I was so desperate to go to sleep or do anything.
Yeah.
That was when I first got tinnitus. With the auditory devices, my friend wears one pretty much constantly, but as soon as he takes this auditory device off, I think it plays music, but it also plays tones
Right.
and sounds through it.
Yeah.
As soon as he removes that, the tinnitus is as bad as when he first got it. And in my opinion, I think if you rely on them too much, you don't give your brain, your mind,
Yeah,
a
you don't
chance
get
to
adapted
retrain
to
itself.
it. Yeah.
To actually, it sounds bizarre, but in a bizarre way, you need to let your brain hear the tinnitus for a period of time to retrain it, to realise it's not important,
Yeah,
it's
I know
not
what you
a
mean.
threat.
You have to get over that fear response with it, you know, just stop fearing it. And that's hard to do when it's particularly bad, you know, we know. Believe me, we do. But if you can get it to come down to a level where it's bearable and get used to it, you know, that's a wonderful thing. And I agree with you on that. I think the auditory devices probably interrupt that process, you know, because you're reliant on that to block it out.
You've just shrouded it, haven't you?
And the idea to me of, you know, oh, I've got this noise in my head, I don't want to hear it, so you add another noise to it.
I think that's just as debilitating in a way, having to wear something on your head all the time is just as debilitating. Why would you want to
I
listen
mean,
to
if they work for
different-
people, wonderful, you know, great, keep using it. But to me personally, it just seems, you know, I want to get rid of the noise in my head, not add more.
I mean, I've spoken about it before. There's another girl with an American girl. She was trying one of the auditory devices.
Yeah.
$5,000 it cost her.
Yeah.
And when she went back to the clinic, they kept saying to her, "Oh, it's working. It's definitely working. You're getting better. We can see. We can see on paper. You're getting better."
Bollocks.
She did. Yeah. Bullshit. She didn't. She said it never worked. She never felt like it was working for her. And recently, she just found it. She'd thrown it in a box for the past 5 years. She recently found said it never worked.
After $5,000
But-
on it.
Just cover ourselves a little bit. We're not saying if you find that you want to try them. Someone's written to me recently
Try
said they're going to try it
anything.
if it works for you. But I would say even if it works for you, don't then end up relying on this.
Yeah.
you know.
Well, when there's things that you can do, like we've experienced ourselves, that genuinely bring the tinnitus down, we're not talking about habituation. We're talking about reducing the tinnitus. Like I've said many times, at my worst, I was hearing 5 or 6 noises at once, you know. And they were all full volume, you know, I could hear it over bands I was playing in, I could hear it over white noise, and I got to the point I was using white noise all day, you know. So I see the allure of auditory devices and stuff like that, but for me, that didn't help. You know, the only thing that helped was focusing on reducing my nervous system activity, calming the body down, getting the tinnitus down to a level I could habituate to, and yeah, going from there.
Yeah, I think that's the best way forward, is if you allow your mind to realise this sound isn't a threat, to really prioritise it and put it.
But again, that is what's
intrusive.
worked for us, you know. It's worked for a lot of people, but all of these things are options. Try them, but I think the fundamental point with it is please don't waste $5,000 on a glorified white noise generator, you know. I think you could save the money and use it on something better.
Particularly companies like this one in Rome, I think a lot of that is a money-making industry. You know, because I know people
how
are
can
desperate.
it cost $5,000?
Yeah, it's just an auditory device.
Yeah.
It's just, there's nothing special about it.
Yeah.
It's just playing sound. Why is it that amount of money?
Get an iPod.
You know.
Well, iPod, you know, smartphone, whatever. I'm not hip and down with the kids.
You know, I'm certainly not down with the kids anymore.
Yeah.
No.
We try, but no.
Okay.
Another question asked is there any medication that can help?
It's your area. Then.
Okay. Right. This is a kind of yes and no answer, really. Yes. As I say, when I had a bad spike, I was put on this drug, gabapentin. Now, it worked. This is the thing. It did work, and it brought the spike down for me. And of course, that was such a relief because it was a bad spike. And of course, then because it brought the spike down for me, and I felt so much better, I wanted to carry on using it. Without having too much knowledge about it, and no one had said to me this has this side effect. I mean, you get the leaflet in the packet.
It will gloss over them a bit.
It lists like basically everything just to cover them. So you don't. There's nothing saying this is going to affect your eyesight. This is definitely going to do this to you. Or definitely going to do that to you.
Yeah.
So I carried on using it, and yes, it did work. But the problem with it is, as with most drugs, the side effects with this particular one, it's bringing your tinnitus down, so it's affecting the neurons firing in your brain, it's suppressing them, but at the same time, without you realising it, it's suppressing other parts of your brain that you don't want it to.
Yeah.
And that's what I started to find, and that's when I started to come off of it. That's when I started to find myself in trouble.
Yeah.
Because my brain was coming back online.
Yeah, so you get a big spike.
Yeah, and all of a sudden, the neurons are firing again, my brain's receiving the signals that the gabapentin has suppressed, and the tinnitus went right up.
Yeah, and that's the problem. The thing you want to do is get back on the drug, because you're that used to the suppressed
and that's
level.
how you feel.
Yeah.
You feel, Christ, this is awful, I'm going to carry on taking it.
Yeah.
And I did go back to my doctor, and he told me it's fine, carry on taking it. Then I did, and I carried on taking it.
Yeah.
But then I thought, no, I'm going to look into this a bit more
Yeah.
off my own bat. I'm going to look into this, and I found that people that have been taking it for years has severe side effects. As I said before, one woman, they thought she had dementia. She was in a terrible state.
Yeah.
Another guy, he had, even in the video, it still affected him. He had slurred speech, but he's getting better.
Yeah.
At one point, he couldn't move his limbs because the gabapentin was suppressing the
It's
signals
the nervous
getting through
system.
to his nervous
That's how we
system.
function.
Yeah.
You know?
It
I wouldn't
directly
mess with
affects
that.
it.
Personally, I wouldn't mess with that. And that's why I don't talk about drugs too much on my channel. Things like that. Because, like Abe said, they can work, you know. But to me, it's always going to be a short-term fix. And while you're reliant on that, you're going to overlook the things that are fundamentally causing the tinnitus. To me, you could be spending that time you're on the drug focusing on getting it to genuinely come down without side effects. If you do it through, call it a natural approach, I guess, you're hitting the fundamental bit. Yeah, I guess. I don't quite like the connotations of it though, you know what I mean? Like, natural, living, that sort of stuff, because, I don't know. Anyway, that's a different subject. I'm getting sidetracked. But yeah, I don't talk about them too much because there's going to be side effects. There's going to be things like that. There's going to be negatives. They're not cures, even though they work. They can work like that.
It's working, but it's the way it works that is the problem with it.
Well, like, I remember when I first started my channel up, I got an email from someone, you know, they were asking, the thing their GP had recommended was to go see a specialist to try a bunch of rounds of anticonvulsant medication, which is basically what the gabapentin is.
Yeah.
And so, you know, I'm not a doctor, I can't give medical advice, I can only give my personal opinions and, you know, thoughts on it. So the first thing I did was Google it, you know, and look it up, how does this work? Well, it suppresses neuron activity, you know, or whatever the specific anticonvulsant does. They work through that medium and just, well, that's going to hit a lot of things. My first thoughts were, well, that's going to hit the brain, that's going to hit all the vital organs, that's going to affect everything. I looked it up, and sure enough, yeah, there can be some severe side effects with it. And everyone will respond differently, and I do stand by the fact that if you're suffering that bad, if you're in that bad of a place, they can be useful in the short term. You know, I'm not knocking that, but they're not cures.
No.
They're not that.
If my advice would be, I mean, if I'd known what I'd known, what I know now about it, I wouldn't have taken it. I would have just tried to ride the spike out as bad as it was, because I should have thought to myself, I know it will come down eventually, just using the natural methods that we use, but I was so desperate that
that's the problem. When you're suffering, if it can help, the temptation is to take it, and that's completely up to the individual, you guys, to decide whether that's right or wrong. Absolutely.
But yeah, my advice is to try and just ride the spike out, because once you get on a drug like gabapentin, you could become reliant on it, and then when you try and come off of it, you're in a world of trouble.
Yeah, you're going to have a rough time with the tinnitus spiking.
Yeah. So, okay.
What natural methods do you feel work that would help to reduce the tinnitus?
Okay, for me, what I've found works best for me is a lot of body-based therapies. The craniosacral therapy that I have, that's always lovely. I love having cranio sessions. That I find gets me into a truly relaxed state, because for me, my body and my mind had forgotten how to relax. I think that's why I ended up with tinnitus. I forgot how to relax.
Yeah.
Even when I used to think I was relaxed, I wasn't really.
Yeah. Well, your own perception of it's jaded. Yeah.
My perception of relaxing wasn't really relaxed.
Yeah. I saw one example. I don't know if it was Julian talking about it, but dealing with patients and that, you know, therapists and things like that. You know, saying to one patient, yeah, lie down on the bed and relax. The guy lies down and says, no, relax. I am relaxed. Well, your head's not touching the couch, you know.
That's it.
Our own perceptions are skewed, you know. We're not neutral, we're not just normal, we are what we are. And the point with this stuff is if we have tinnitus, objectively speaking, we're too overamped, fundamentally. We need to calm it down.
It's what we said before, within the tinnitus community, there seems to be personality traits that seem to come up a lot. We overthink things, our minds are too active a lot of the time.
Yeah, perfectionism's
all that kind of thing. So craniotherapy I find very, very helpful. Tai Chi, I find that while I'm practicing my Tai Chi, I'm not hearing the tinnitus, because I'm focusing my attention away from my mind into my body with the movements of the Tai Chi. I find that very, very helpful.
Yeah.
And also going to the gym, similar type of thing. The way I train now is different to how I used to train pre-tinnitus.
Yeah.
You've heard me say before, when I used to go to the gym, I'd be very aggressive.
Yeah.
Get the reps out, all of this kind of thing.
Yeah.
You hear it all the time at the gym. You know, there's no need for it.
Yeah.
You know, all of that kind of thing. So I train differently now. It's much more of a mind into my body, mind over matter. Similar type of focus while I'm doing the training with the weights as I do with my Tai Chi, and I find that very helpful. And now when I come out of the gym, I feel relaxed, not exhausted.
Yeah, like I said, that's like almost an active form of meditation.
Yeah,
you know,
relaxed. So yeah, for me, Tai Chi, going to the gym, training without aggression, and the craniotherapy I find very helpful, and also other things, just going for walks in the park with my little boy and Amanda, anything that's calming and relaxing.
Anything that will calm the nervous system will, you know, look it up. There's a long list of general stuff that will help, but like with my experience with things, you know, I've done meditation, I've done Qigong, I've done things like that. They all kind of have an effect. For me, the fundamental point is it's in your day-to-day life. the things you overlook, the fundamental outlook you have and the way you respond to the world, that's what's causing the nervous system to be overactive. That's the big part of what creates the tinnitus. That's where my focus is. It's in my general day-to-day life. You know, I can do a session of meditation and drop into a more relaxed state, and yeah, I do hear it. You know, my tinnitus will bounce about as it changes, you know, things like that. Not like drastically, but significantly so. But if you're only getting into that state during that 20-minute window, your tinnitus isn't going to go anywhere long term. For me, my focus is entirely on generally trying to change my outlook. And this is a long, you know, it's basically trying to practice different personality traits in a way.
I've said before with myself, I've almost had to change part of my personality. In what you've just said, I agree with what you've just said in the way that I react to the world around me in everyday life, particularly at work. Whereas I used to feel pressured and I would react aggressively and get in states of, you know, you're being pressured all the time, and it would irritate me and I'd get enraged about it. And now, as you say, in everyday life, try and react differently to what the world throws at you. That is something I think is
so that's my focus. You know, for me personally, that's what's worked for me. But you know, it's a long process and it's complicated by having to deal with the freeze response to stress, you know, emotional numbness, things like that. It's hard to relax if you don't know you're tense. You know, a large part of it is to figure that out first, you know, find out what's going on. And everyone will have different things they have to deal with, you know. It's no good me just saying, oh yeah, you know, I've got emotional stress because of blah blah blah. And if you go assuming you've got that, it won't help you. You need to figure out what it is in your own case on a day-to-day basis. You know, look up, you know, I've got that link, you know, on one of my videos to that article on about the parasympathetic nervous system. And that's a brilliant article because it sums up just how out of whack we are with the modern environment, how elevated our general stress levels are, and it's that part you need to deal with. It's that part you need to address. Whatever way you go about doing it, you know, Tai Chi, all that stuff, they're great. You know, they can work really well, and it adds up. But the idea for me is take from that state, learn from that what that relaxation feels like, carry it with you throughout the day. You know, stay in that state more and more, practice being like that, practice being that person, and over time you'll gradually start to uncouple all the neurons that are used to firing together. You'll get rid of the habits that lead to the physical changes in the body that create the tinnitus.
And
that's about it.
It's not easy because when you've been used to living and being a certain way for so many years, it's not easy to just change the way that you react to the world around you.
It sounds ridiculous as well, you know, with just, I need to get rid of my ringing, how do I do that? Oh, relax, you know.
Yeah, it's not.
It's hard.
You can't just say, right, relax, and you're relax. You have to work at it, and like I say, almost revisit your personality and the way you react to things.
That's a good way of summing it up.
And I still fall in. Sometimes I still, let myself down a bit, and I will react because it's still within me.
That's perfectly natural, though. But it's a long process.
But it's getting less, and I'm learning to remain calm and, like you say, the state of mind I get in while I'm having Tai Chi or Cranio, trying to put that into my everyday life.
Stay in it.
But it's an ongoing process, and
you know, these habits that lead to developing tinnitus, they built up over a lifetime. You know, that's not going to come undone from one session of meditation or whatever, no matter how good it is. Or even, you know, craniosacral therapy, as good as that is, it seems to be the best manual thing for affecting these factors that cause the tinnitus. So, you know, recommend that. I haven't had it yet. I'm planning on trying it at some point because I think it's a experience I could do.
I find it very, very helpful. It's for me. That's what taught me again how to relax again. That's what
you
taught
learn
me
what
again
it feels
how to
like.
relax.
You can,
it was kind of like I rediscovered how to relax.
Yeah, so you know what you're looking for without knowing what you're shooting for. It's like trying to, you know, hit a target in the dark with a blindfold on. You know, so that's why I think these things are useful, like meditation, Tai Chi, all the usual list we give. You know, tapping I've added to that list now. They're all useful because they'll help guide you in the right direction. You know, so try them. You know, try those things. I can't even remember what the question was now.
It's natural methods.
Yeah, we are still on topic. That's a relief. So try those things, take from them, and start practicing staying more in that state throughout the day. Just anything to reduce the sympathetic nervous system activity throughout your day. And it'll add up. You'll get better at it. Yeah. that's my advice on that.
Okay.
Yeah.
Have either of you experienced any difference in your tinnitus through your daily diet? Do you feel that it has an effect on the tinnitus?
Okay. I've always had a pretty healthy diet anyway. But like I say, pre-tinnitus, I had bad IBS, even though I had a healthy diet. And I believe this was my body letting me know that I was living in a state of stress and anger, anxiety, and my body was reflecting this in the IBS. Had I had a rubbish diet, it could well have been worse. Post tinnitus, I improved my diet further. I think it has a degree of a factor in it. If I had a terrible diet, it could affect me. I don't know.
It's a factor.
I don't know because I've always had a healthy diet. So I don't know. I think if I had a rubbish diet and I was eating junk all the time, it could well have an effect and make it worse. But I can't answer that really because I have a healthy diet. So I'd have to start eating rubbish to find out if it made it worse.
And that's where my answer comes in the picture, because I've experimented with different, I look at obesity, things like that. That's where I come into looking at health in the first place. But I've found, for me personally, diet has almost no impact on my ringing. It's nowhere near a big enough thing if it is a factor for me to take note of. The one thing I do notice is alcohol. That tends to do it. I'm not sure if that's because of the type of alcohol I drink. I don't really drink much, to be fair. Maybe that's why it does. I'm not accustomed to it. But yeah, mind you, we chugged that JD back pretty quick last night.
You feel okay this morning?
Yeah.
Yeah.
I was up about 6 hours too early, but yeah. But yeah, so diet, it's not a factor I'd focus on. Long term, it's going to have no impact. On about like IBS and that. I've seen studies where they, put people on a healthy diet, and it depends what you define healthy as, And it's a slippery slope as well, because with a lot of people, they'll get restricted with the diet. They'll experience some sort of short-term improvement, because it can, I think the fundamental issue with like digestive stuff is too much sympathetic nervous system activity. It will literally suppress your digestion. But a lot of people will experiment with diet. They'll restrict certain foods, the usual ones that will exacerbate the problem. And they'll get that bit of improvement, and they go, it must be the diet, it's all on the diet. And so when inevitably it stops to work so well, they'll get stricter, and they'll get that little bit of improvement again, but it's always a smaller amount each time until you get to the point where you're only drinking water. It can get pretty extreme with a lot of people. I'm not saying, it's not really what we're talking about, it's a different subject really, but for me, I think the focus on diet is drastically overstated. There are way bigger factors going on. I've had periods where I've lived off of nothing but chocolate, things like that, and it never affected my tinnitus.
Don't give her ideas, please.
Yeah. Again, it's a different discussion. But yeah, so if you find something does affect your tinnitus, it makes it spike or whatever, by all means experiment with reducing it and all that sort of thing, but I think my fundamental point is, personally for me, don't look to diet as the saviour for your issues with tinnitus.
What do you think about, there's one of our subscribers, Flavia.
Hi.
Yeah, hi Flavia. She's been trying different forms of, I think it was one of the things, was it mocha or
Mocha powder, stuff like that. I can't remember.
Yeah, she was trying different supplements and herbs and so on that are supposed to help it.
They can, definitely they can, but again, my focus personally is on, if you have digestive issues and they're exacerbated by certain foods, my focus is not on the foods. If you have poor digestion, it's because you have poor digestion, not because you eat too much of a certain type of food.
Ginkgo leaves, I think, as well. Something called ginkgo. She that seems to
come up
a lot. Ginkgo.
Yeah.
I've never tried it.
No.
But I don't.
Again, my focus isn't there. My focus definitely isn't there. If people ask me, I will say that's not where your primary focus should be. By all means, try things. Definitely try different things out. See if they work for you, and if they do, great.
Yeah.
But my main warning, based on my own experience with looking at diet, is don't chase it all the way till you're only drinking water and, salads and not touching any other food because of fear of it. That's not a healthy thing at all, So just experiment, but be cautious with it, you know.
With me, I try and eat healthy throughout the week, training and so on, but at the weekend I'll eat what I like.
Yeah.
I'll eat what I like last night I had Chinese, and I'll have, like, over the weekend I'll eat what I want. So,
yeah, and that's definitely a better way to go about it, I think, because you deal with all things. If you're getting a craving, and we really are getting a different subject here, I'll keep it short. If you're getting a craving, the body wants it for a reason, you know. It could be an emotional one, could be a physical one, could be whatever. To try to get around it by just cutting the craving, you know, just cutting it off, that will have a negative impact on the body to some degree, and that can add up over time, but that really is a separate subject, and it's a big one to get into.
So yeah, I think
yeah, we don't
think
focus on it.
It's got a big impact on tinnitus.
Again, experiment, see what works, but don't just go lopping off massive food groups, you know, if you experience a bit of improvement, you know. Be on the safe side with it, be on the cautious side as you experiment. That's, yeah, I think that about sums it up.
Yeah.
This is more a question for Gray.
Okay, am I recording? Just checking. Yes, I can see it ticking. We're fine.
Is the TMJ joint a factor?
Yeah. Next question. Yeah, it's definitely a factor.
It's not your usual style.
No, I'm practicing keeping it short.
I know you want to keep your video short. So you've
Yes.
to the extreme there. You've done it.
Yeah, I know. Cracked it at last. But no, that again, it's a long topic, and it spirals into all kinds of other health issues. But the fundamental point is that my advice to people looking that think it could be an issue with them, check out the Orthotropics channel on YouTube, here on YouTube. You don't have to go very far, you know, go look at that. They have theories that seem to bear out in reality. They seem to cover a lot, because with most dentists and most people that deal with the joint, they don't know what causes TMJ, you know, they don't know what causes dysfunction there. So if you're trying to treat something, you should bloody know what you're treating, you know, you should know why it's a problem, you should know why your treatment's going to work. They just have treatment, they don't have cure, they just have treatment, which is an issue. The orthotropic stuff is a very different field. It subscribes to the theory that basically, as I described in my latest video, the jaws are not grown forward enough in the face. They're set too far back. And if you look up examples of indigenous people, ones with better developed jaws, there is a drastic difference between what you generally see, you know, on the train on London coming here, you know, and what you see out away from these environments that cause the face to grow downward. When they're too far back, all the soft tissue all the soft tissue in the face gets compressed. It all gets pulled in, it all gets impacted, and that includes the nerves of the jaw and the spine. Obviously that's going to have quite a strong impact on things like tinnitus, you know, issues like that. And again, it affects everything in the human body, you know, well, yeah, it's a big subject, and I really will ramble too long. But it affects it. It's a definite factor. I do not believe for a second it's the cause of tinnitus, you know. I believe it lowers the threshold, you know, because if all the stuff's compressed, if it's all affected, it can get inflamed easier, you know, all those kinds of things. Generally, poorer jaw development, jaw joint issues, they will predispose you to tinnitus more. I think that's the general point with it. So if you think it's a big enough factor, by all means look into that stuff, look into orthotropics, look into proper oral posture, myofunctional therapy, things like that, and, you know, see if it really is a big issue with you. But that is a big thing to fix. If tinnitus is your only issue and you're not having any major issues with the jaw joint, don't bother. The emotional stuff is the bigger factor to address there. I recommend looking at that. Don't worry about the jaw joint too much, even though it is a definite factor with tinnitus. My key point is it's not a causative factor, you know, although it could seem to be in many cases, and if it seems to be in yours, have it looked at.
Right, next question asked, what can make tinnitus worse and why does it spike?
I think the main thing that makes tinnitus worse, I would say, is stress.
Yeah.
Yeah. Every day, the way we live, like we've been saying, modern lifestyle.
Yeah.
Stress. Even when you think you're not stressed about any one particular thing.
Yeah.
The
general background level.
Background
and
stress.
once you're at that point where you're maladapted, where, you know, your body's responded to high levels of stress, if you're just staying in that state a bit, just a general light level, your ability to heal, you know, to go back to normal, that's impacted. So yeah, it's stress fundamentally of various kinds. That accounts for all the different things, you know, like some people getting into an argument will spike it, others it won't. You know, all that sort of stuff is accounted for by the fact that it's the nervous system that's causing the variations with the tinnitus.
I think anything that heightens your neural activity can have an effect. Particularly with at work, I get a lot of people saying to me about being at work, and like Scott Sutherland, I know he's recently changed his job, and he's feeling better already. He's feeling better.
Yeah. Way to go, Scott.
Yeah. Good move, Scott. When he was at his previous job, he was getting stressed and anxious at work, etc., and that made his tinnitus worse. Now he's changed his job, he's in a better environment, he's more relaxed at his work.
Tinnitus is generally lower.
And
I think he actually had a breakthrough the other night, you know,
yes,
if anyone
he had
hasn't read
some
that.
moments of silence, had some silence.
Which is awesome. It proves it completely, you know, just generally get that level down, whatever way you go about it. You know, you have to figure it out yourselves for the most part, unfortunately, but experiment, look at this stuff, pay attention in your own lives and try to bring the stress down, and the tinnitus will come down.
30 minutes, I think Scott said, that he had of what he calls true silence.
Yeah.
And I said to him, you know, if your brain is capable of having that period of time, it's capable of doing it for longer periods of time.
Just keep wiggling it further and further in that direction.
You know, it is capable of doing it.
That's why I say to people, you know, the main hump, the worst bit to get over is where you've got tinnitus and it's bad or it's getting worse. To get it to stop and get back that little bit, just to experience that little bit where it's backed off just enough for you to actually start to really believe it can get better. Because until you do, it's just words on a page, you know, or just videos. It's just words, and it's hard to believe. And with this stuff, we're talking about the nervous system, we're talking about your emotions. Belief is half the battle, I think. You know, I had to just run on a leap of faith, you know, that this stuff would work to get my tinnitus to calm down. And it did, you know. It worked, it got me, you know, away from the edge with it that bit. That was all I needed to be able to believe it really can get better. And it's improved since, you know.
And when you have these moments of silence, I mean, I'm lucky enough to have the 3 days I was on holiday. Once you've had that, that reinforces, tells me, proves to me that your mind is capable of removing this sound from your conscious thought. Doesn't really matter, you know, where it's put it. The fact is, you're not hearing it, and that's all that's important. You know, whether you call it habituation or, you know...
Well, that's a cure, you know.
It's as good as, that's as good as, isn't it? If you're not hearing it, that's as good.
Like, I put myself at that level, you know, I don't call myself a tinnitus sufferer anymore. I've still definitely got it, and it can still spike. You know, it spiked the other morning, actually. It was just blaring. And, yeah, I basically find it funny, because it means I've done something to spike it, you know, whatever it is. Some things happen just, don't do that again, you know. It's at a level where it's calm, and I consider that a cure, you know, compared to where I was at before the new year. Just the fact that I can live my life without worrying about it. And you all can too. You can all get there, you know. It's not easy to do, but it's very possible.
And this is what people that have recently been struggling need to hear, that you will be able to get to a better place.
Yeah.
You will be able to do that, and you will be able to live with the condition.
And you know, I will make videos till I'm old and grey, just repeating that again and again. You can get better. You can get better.
And if you want to look at right at the end of the scale, look at people like Julian, who lives a tinnitus-free life.
Yeah, he might not be a brilliant example of what we can all expect with doing stuff, because obviously it's a big thing. It's a very big thing to accomplish, changing the stuff that's causing it. But it can be done, you know. That alone, knowing that, is what got me to start improving mine, you know.
Yeah, he's a big inspiration.
Yeah.
It's a big inspiration. But yeah, generally what I think the biggest factor is stress.
Yeah.
That's that.
Again, yeah, I think the better way would be what can't spike it, you know, what wouldn't spike it, because it depends on all of us. It really does, you know. Just the general thing is stress. That's the fundamental point.
Somebody's asked, when you're actually going through a spike, what should you do when you have this?
Relax.
Don't panic.
Yeah.
Don't panic. Yeah, it's hard to do, I know. I mean, I've had my tinnitus, it's still less than a year at the moment. I got mine in last October.
He's a baby.
Yeah, yeah, still fresh.
Yeah.
and when you get a spike, it is like, oh my God.
Yeah.
You know, but the best advice I would give is don't panic. I've had a couple of spikes now. They do always come down.
Yeah.
So
No degree that you get tinnitus to, or nothing that caused it, means it's permanent, you know. And they're, you know, with the spikes being from some kind of stress, they're always from something that stimulates the nervous system, you know. That can be anything. It can be a benign thing you can completely overlook. But the point is, they do happen, you know, they can happen. But they do come down. They can always come down again. The important thing, the most important thing above all to do to deal with a spike, do whatever you do, you know, to cope with it. Play white noise, you know, play it loud or whatever. Do things, busy yourself, distract yourself from it. The biggest, most important point with the spike is not to feed it with negative emotions. You know, don't stress about the spike. Don't get locked in a loop. If anything's going to make it stick about, that's what will do it.
It will feed on it. If you get stressed, panicked about it, frightened about it, tinnitus feeds on those emotions.
Yeah.
So just try and write it out.
Yeah, it will come
calm.
down.
Yeah.
Do whatever you can to cope with it in the meantime. Just get from one moment to the next. But always remember, first and foremost, it will come down. It will get better.
I mean, recently coming off of this drug with the spike that I had, it felt like it was a good couple of weeks where it didn't feel like it was going to come down, but it has.
Yeah.
Like, it always does.
Yeah. And I think an important point that the stuff that goes with the spikes, you know, with it being stress and that, you will physically be predisposed to being anxious, to being stressed, to being worried about it. You know, your brain will be going a million miles a second. Just, oh, is it permanent? Is it, you know, all that stuff. You know, I felt it the other morning when I had my spike, and it's the only actual spike I've had in about 3 months, but the physical stuff was there. And it was a really strange experience, because consciously, mentally, I know this is just a state I'm in. It will come down, it will pass. Just, you know, go back to bed, go do something, whatever. And yeah, it passed completely. All of that physical, emotional stuff, that's not rational thought going on. That's a stress response. Don't worry about that stuff. You know, just because you're feeling those things, you're worrying that it's going to be permanent, it doesn't mean it's objectively got any weight. You don't have to worry about those spikes becoming permanent. They can come down. They always can.
Yeah.
So always remember that fact. You know, just always keep that in your mind.
It's going to be alright.
Yeah.
You're going to be okay.
Just write it out.
With doing the Tai Chi and yoga and advising people on this to help reduce, you know, to calm you down, why does that help?
I think with Tai Chi and with something like yoga, I think it's because you're taking the focus away from your thoughts. You're instead of having all your thoughts whirring around in your